Orthodontic surgery is the part of the oral and maxillofacial area to correct the problems on a overbite, like prognatisms or retrognatisms. That means if the jaw is in a very forward position or in a very back position, or if the patient has too much or not chin, or if the patient smiles and shows a lot of gum during the smile, we can move the position of the maxillary, the upper, the lower, the chin, to put it in the correct position. The origin of the bad position of the bones, sometimes can be genetic, but most of them is growing problems. And most of the cases, we prefer to send the patient first to the orthodontics to move the teeth to the correct position and then make the surgery. But there is some cases that we can make the surgery first and then send the patient to the orthodontics to move the teeth to a good position, and then everything is going to be correct at the final. Okay, to explain more about the surgery, this kind of surgery is under general anesthesia, and we take the patients to a very nice surgical room. I mean, everything is perfectly in there, and to move the lower jaw, we cut the ramus of the jaw. We make some technique, Obegesser technique, that's the name of that technique, and then we can move forward or back the lower jaw. To fix to make a good fixation, we use titanium screws to put the jaw in the new position. Those titanium screws can be there for forever. The patient wants to send only the x-rays. Okay, the x-rays is antero-posterior x-rays, lateral x-rays, panoramic x-rays, and it's very important to send the models. The models means go to a dentist in your area. It's very easy. Take an impression from the mouth. He or she can put it in stone models, and you can send it over here so we can study your case, including the x-rays and the models. And then we can I can give you an idea what kind of surgery the patient needs. At the time the patient come to us, same day, early in the morning, we take the blood test just to be sure that everything is fine. Of course, first of all, we make some research by email with the patient to know more about the medical status. But we send the patient to the laboratory, and next day we can make the surgery early in the morning, and the patient is going to spend a night into the hospital just to be really, we have to check him in the afternoon, and next day he or she can leave the hospital. So the patient for orthodontic surgery has to spend maybe 4 days here in Tijuana, and then can return to their places.